So, Doc Sahab, what are the requirements? Like some people say that even working in some department for 3 years, even without training. So basically, working in any department for 3 years, you can apply for MTI. Is it true? How long we have to wait to work there as a consultant? For example, if somebody is medicine specialist here in India, he's already a consultant working as a consultant. He goes via MTI Pathway to UK and he clears MRCP Part 1, 2, and 3, I guess. So how many years does it take to become a consultant and stuff? This question is important for my audience because sometimes they think like we'll work in UK for 1 year and move to Australia, but that pathway is just for PLAB candidates. If you have cleared PLAB, got a job and working 1 year, not after clearing MRCP or something. So once you become a consultant, then you can think about moving to Australia if you're thinking like that. So that's for the audience. Talk about the money aspect, how much you spend in this pathway overall, like a rough idea, and how much you'll earn once you become a consultant, and also while you are getting trained, maybe it's MTI trainee or maybe advanced trainee. So what are the like rough figures? Just and one more questions from our audience, like what are the visa situation for the spouse, children, and parents? And now the most awaited question: what about money?
Yes, money. Everyone wants money.
Yes.
There is a system of banding, 1A, 1B banding, depending upon how many unsocial hours and how many extra shifts you will be doing as a part of your rota. So that gets added as well. So the banding for 1A is 40%, 1B is 20% add on.
Hello everyone. Today we have Dr. Deepanjali with us. She's a respiratory consultant. She worked in UK for 1 year in the field of respiratory medicine. And she didn't go via PLAB route. It was some special pathway. She'll be telling us all about that pathway. And welcome, Dr. Deepanjali.
Thank you so much, Dr. Rajat. It's been a long awaited video and so happy to be here.
Yeah, hello everyone. Doctor. And lots of people, lots of doctors were asking, Doctor, we want to explore the UK option as well. And so here we go. So yeah. So Doctor, tell me, what was your route? How you went to UK without PLAB?
Yeah. So this route is called MTI route, or Medical Training Initiative. So what happens with this route is, the advantage of this route is that people who have trained in countries like India and Asian countries, anywhere outside of UK, and if you've not gone through your MRCP exams yet or PLAB exams yet, that means you don't have a GMC license, but you can show that you have already trained in specialty at least for 3 years after your primary medical qualification, that is MBBS for us Indians. If you can show that, the Royal College of Physicians or the Royal College of every specialty, they have the sponsorship route where they can sponsor your license. And then you can move abroad with the GMC license and the sponsored visa and work there.
That's good.
The total duration is around 2 years max. And then it depends upon you if you want to come back or you want to stay further on.
Okay, so Doc Sahab, what are the requirements? Like some people say that even working in
not entirely true, because you have to show that you have trained in that specialty. So you have to have your proof of training in that specialty. So super specialty training, that is post graduation in India, is considered as a specialty experience. So you have to show the proof for that. So post MBBS, any experience, like any degree, be it DNB or anything, it is counted as a clinical experience, and so is MD. But then that is not a specialty experience per se. You have to have specialty experience to move abroad.
Okay, so if somebody has completed MD or DNB in medicine or gynae, or they can go via MTI route to UK to work as a registrar in that specialty. And
that's right.
Yeah, meanwhile they clear the MRCP exams and sit into subspecialty training, right?
Right.
Okay.
Yeah, that's the long and short of it.
Yeah.
Yes.
And so Dr. Saab, these are the requirements and this is the process. So how long we have to wait to work there as a consultant? For example, if somebody is medicine specialist here in India, he's already a consultant working as a consultant. He goes via MTI Pathway to UK and he clears MRCP Part 1, 2, and 3, I guess. And now what's after that? How many years and what's the procedure?
Yeah. So for any candidate, so MTI is basically a pathway that covers your stay in UK and your work experience for up to 2 years. And that's where the MTI pathway pathway ends. But there are a lot of routes by which you can extend your stay further on. Okay, so considering about, say, if I'm an MTI fellow, I've completed my 2 years, and now I want to move up my training, and I don't want to train in the specialty. Like, I don't want to become a ST3, ST4, 5 fellow in say my own specialty, because I've already trained in India. But I want to become a consultant and stay further ahead. There is a pathway called the portfolio pathway. It was initially called the Caesar pathway. It is considerably a longer pathway. What basically happens is this helps you get your name in the specialty register.
Okay.
Which is the prerequisite for anybody to become a consultant. You have to have your name in the specialty register. So either you pass your MRCPs and then you enter the specialty there, or you go via the Caesar pathway for people who have maybe, say, a long time of experience in that specialty in their home country. You have to have a long documentation process. There is a specific guidelines they have, all the Royal Colleges have on their websites. It is called specialty specific guidelines. And then portfolio pathway, they have a different portal and everything. So you have to upload all the guidelines. You can even contact your respective Royal Colleges for it. And then once you're done, they give you around 6 months to collect all the documentation, and they will be communicating with you back and forth if they need any further documentation. And then if everything is sorted, if all your competencies are at par with any trainee who might have trained in the specialty in UK, they will agree to give you the due qualification for a consultant level registration, and then you can work as a consultant there.
Okay, so how many years does it take to become, like, if you go into specialty training again, like after your competencies and stuff? So how many years does it take to become a consultant and start working independently?
Right. The number of years of specialty training is different for all the specialties. Say for respiratory medicine, it is 4 years post your IMT 3 stage. That is, if you are a MTI fellow, you will join at ST3 or ST4. You work there for 1 or 2 years. After that, once you enter your training, that is when your training period will start. So it goes up to ST7. So now you will become a specialty trainee, and then 4 years you will be training then. And by the time you complete your training, you have to pass exam called specialty certificate examination. Okay, that is also hosted by the Royal Colleges, and that is when, once you've completed everything, you complete your specialty training and you become a consultant there. So it is 4 years post your IMT 3 stage. That is, if you are a MTI fellow, you will join at ST3 or ST4. You work there for 1 or 2 years. After that, once you enter your training, that is when your training period will start. So it goes up to ST7. So now you will become a specialty trainee, and then 4 years you will be training then. And by the time you complete your training, you have to pass exam called specialty certificate examination. Okay, that is also hosted by the Royal Colleges, and that is when, once you've completed everything, you complete your specialty training and you become a consultant there.
So, for example, if somebody is MD medicine from India, he goes there by MTI Pathway, and while working as an MTI fellow, he clear all the MRCP exams. Then he'll he'll apply for specialty training. For example, let's say cardiology, and for that, there's interview based, just like Australia.
It is interview and competencies based. So it depends a lot on the person individually, because it's not like anybody who applies gets to it. So it depends upon how many years you might take to collect all your competencies.
Okay.
There is an e-portfolio system. I'm not sure how that is in Australia, but in UK, every trainee or non-trainee has to maintain an e-portfolio.
Okay.
So what happens is, and on the basis of your e-portfolio, every year there is an appraisal that happens, and that is how you get promoted on to the next year of your training.
Okay.
Yeah. So during the time, even the non-trainees, like the people who are going for, like, as a MTI fellow, they will also get this e-portfolio. It is also sponsored by the Royal College. They get it, and then you have to keep updating it.
Okay.
So it depends how long will you take to get all the competencies, and then once you are done with all the competencies, you apply. And there is a national scoring system and everything. If you get selected, you will be selected for the interview, and then that is how it proceeds.
Okay, and then there is 4 to 5 years of subspecialty training, and then you become a consultant. So basically, once you move to UK, it will almost take 7 to 8 years to become a consultant, right?
Minimum 4 years, minimum 4 years of specialty training. If you include the MTI, then it's 6. So, and say you need one extra year,
Yes.
or you don't get selected that year, so 7 years, 7 to 8 years.
So 7 to 8 years in nutshell.
Yeah.
This question is important for my audience because sometimes they think like we'll work in UK for 1 year and move to Australia, but that pathway is just for PLAB candidates. If you have cleared PLAB, got a job and working 1 year, not after clearing MRCP or something. So once you
Right.
become a consultant, then you can think about moving to Australia if you are thinking like that. So that's for the audience. And okay, doctor. So you cleared, you become a consultant, and that's the procedure. We'll talk about the money aspect, how much you spend in this pathway overall, like a rough idea, and how much you'll earn once you become a consultant, and also while you are getting trained, maybe it's MTI trainee or maybe advanced trainee. So what are the like rough figures? Just
Yeah, so rough figures is like you don't spend a lot while you're doing the application process. There is a little bit of like 125 is the initial application fee. Once your application is shortlisted for the MTI process, that is when you pay the remaining fee of £725. 125 is the pound that I mentioned. Okay. So and then from there on, there are some expenses like you have to sit for your IELTS as well. You have to have your TB certificate, visa processing, everything. So all in all, but then the other thing is your flights, your visas, and then your ECFMG certification, all those, and then moving there. So you have to, and then you have to also have some amount of money in your bank account to get the visa as well. It's around 1.25 lakhs for the primary visa holder and around 25 or 30,000 for your dependent.
Okay.
So all in all, I think it amounts 8 to 10 lakhs minimum for the entire thing. Some trusts do reimburse your flight and your visa costs when you move there, but it happens after 2 or 3 months when you get your payroll and everything. So up to £2,500 was refunded to me by my trust.
Oh, that's good.
Yeah.
Maybe they knew that they are bringing a good doctor, so they wanted to give you extra. That's good.
Keep it in.
Yeah. And one more questions from our audience. Like, what are the visa situation for the spouse, children, and parents?
Yeah, so parents, unfortunately, you cannot bring your parents on that direct residential visa. They can have visitor visa. Maximum duration is around 6 months. For you, if you are the primary visa holder, all MTI fellows are usually sponsored a tier 5 visa. So that is a temporary worker visa, you can say. It's a skilled worker, temporary worker visa. And then some trusts do agree to sponsor the tier 2 visa. In that case, your Royal College will not have to sponsor your visa. Your trust is doing it directly for you. So then you can directly have a tier 2 visa. It is also a skilled worker visa, but then the difference is that tier 5 visa basically does not count if you are planning to stay further ahead and if you're wanting to get ILR further on and then convert it to your British passport. Those 2 years on tier 5 visa will not count. So tier 2 visa from day one, it will be counted as one of the 5 years that you've stayed on the tier 2 visa. And then 5 years, after 5 years, you get the ILR. So that is the basic difference. And other than that, your dependents can come with you, like your wife and your children or your spouse can come with you on the dependent visa on the corresponding visa that you've got. Tier 5 dependent or tier 2 dependent.
Okay.
So money is basically the salary of an MTI fellow will be at par with any specialty trainee there. Depends upon the grade, whether you're ST3 or ST4, ST5. You have to show your competencies, like I said. So, and the trust will negotiate with you according to how many years of training you've had. So it gets counted from your internship years. Like internship is 1 year, post MBBS, and then 3 years of MD, and then if you've done your SRship a couple of years as well, that counts as well. And that is how from the grade of F1 they count it, and then wherever you land, whichever is your final year of your training, that is the band that you fall in. So the best part in UK NHS is that the salaries are all band based, so with yearly increments and everything. So whichever band you fall. But all in all, there is not much of a difference in the salary of a specialty trainee and the MTI trainee. Some trusts follow the older pay bands, but you can always negotiate. So on your that application page, on your job description, they usually mention the pay scale that they're going to follow. Most trusts nowadays follow the newer pay scales. Some they already advertise they will be following the older pay scales.
So yeah, in
that's
Indian
how it is.
rupees, for example, at what grade, if a medicine specialist or a respiratory specialist is applying for MTA pathway, usually it's gonna
Right.
be 4 to 5 minimum, right? The band.
Yeah, your basic pay is actually around, it starts from 37, but it has moved up a little. So 42, 44 is for ST3. It has, if I'm not wrong, now it has even increased to 49 as a starting for ST3. So 49,000 pounds per annum.
Per annum, okay. And how
Yes.
many hours of work?
It is 40 hours a week on an average, not more than 48
Okay, so basically, you earn around 40 to 50 lakhs per year in
per
Indian
year.
rupees.
And then it also, this is the basic, and then it also includes, if you're doing on calls or if you're doing weekends, there is a system of banding, 1A 1B banding, depending upon how many unsocial hours and how many extra shifts you will be doing as a part of your
Yeah.
rota. So
Yeah.
that gets added as well. So the banding for 1A is 40%, 1B is 20%, add on to your gross pay. So you get according to that. So it adds on. When I went for my contract, I went on a Monday to Friday, 9 to 5 rota. I didn't have on-call commitments or weekends. So I was getting the base pay.
Okay.
But there is always a scope for, doing extra shifts at your own trust as well.
Yeah. And
Yeah.
how's the expense? Like you're earning around 40 to 50 lakhs per year. How's the expense? Because the housing is a bit of a shock, I guess.
Yeah, the housing is expensive. So the thing is that most of the bigger places in UK, like London, Manchester, or places around these places, they are more expensive. Some remote places or smaller towns are a little less expensive. So it totally depends on where you're staying. Just like it is in India, like Mumbai, Delhi, Bangalore is very expensive, but then smaller places are less expensive. It depends upon that. Expenses on an average, if you are a bachelor, you can stay in a 1 BHK. You can get a 1 BHK
Studio
around
apartment,
up to
maybe.
800. Yeah, studio apartment maybe 800 pounds. No, it should not be more than that. 8 or 900 is like the maximum and a very posh place in a town.
Yeah.
For London or Manchester, it can go up to 1100, 1200. So all in all, that is the basic thing. And utility bills are almost the same for everybody. Grocery, and if you have a family, your grocery expenses will be a little more. I used to spend, like me and my husband, we were staying. So our monthly utility expenses amounted to around 1800 pounds in total, including the rent of 1200. So apart from the 1200 was a rent per month, and then utility, gas bills, grocery, 1800.
So basically, if we roughly calculate, you're earning around 45 lakh over 12 months. So you're roughly earning around 3.5 to 4 lakhs per month, and your expense is around 1.5 lakh, I guess. And sorry, we forgot
You can
to.
take it as two.
Yeah, okay. We forgot to talk about the tax, because if you are earning 3.5 to 4 lakhs per month, how much is that tax you are paying from
Which
that?
is the base tax is basically it's around 40%. So yeah, it's quite high. Yeah. UK tax system is
Yes.
so yeah, whatever. So yeah, so it's quite high. So in hand you will be and then you have your NPS commitments. You can choose to opt out of it. I opted out of it.
Pension
So
service,
you can get around 3.5 lakhs in hand, and then you will be spending around say 2 per month.
So 1 to 1.5 lakh will be your savings if you live in a okay house and normal expenses, right?
Yeah, if you're not living in London or Manchester, I'd say, because expenses are way higher there.
Yeah, that's cool. So
and that's for a ST like specialty trainee. Like I was a ST 5 grade registrar there.
Yeah.
But then people usually start at ST3, so then it's a little lower for them.
Yeah. So maybe that's why you came back to India, that earnings were not not much.
Yeah, but people think so, but I never intended to stay that long. Maybe I would have added on 1 or 2 extra years.
Yeah.
But then it's just
actually, it's a great experience. Once you start working in a developed country, you're
Exactly.
brain opens like, okay.
Exactly.
Yeah. So
Yes.
even I had the similar experience. I worked in India for many years and I was good with my knowledge and my confidence was great. But once you move to a different country, you see it's not about medicine only. It's about other aspects as well. So
Exactly.
yeah, that's a very good
It's a
exposure.
very new concept in India.
Yeah.
We don't have that exposure.
Yes, definitely. You can diagnose, you can treat, but the other parts and the mentality changes once you work. So if somebody from my audience is thinking about going to any country, UK is a very good option. Not for
Yes.
earning, but for an experience. For example, just like Dr. Deepanjali, she worked for 1 year in UK and she has got this exclusive experience of a developed country. And yeah, that's your choice. Tell me, Doc Saab, what are your thoughts about, what are your messages for our audience basically?
Yeah, so basically, I would like to say, like, everybody should move abroad once, like we just talked about, because it's not just about a professional, upgradation. You have that professional upgradation, but the hold that you get over your specialty, and then there is a lot of personal development as well. And the third thing is that you learn about people in a very different way. You interact with people from the other part of the globe, and then you work with colleagues from different parts of the globe. It
Yes.
just opens you up in very different ways. One of the things that we don't have in Indian healthcare is the discharge process that we had in the NHS. Like, it's not just getting the patient hale and hearty and fit and just getting him out of the hospital. There is an entire process of how the person is going to fare when
Yeah.
he is at home after his discharge.
Yes.
So they have dedicated teams for that, for managing that, including physiotherapists and discharge officers,
Yes.
which was very new to me. And now that I've come back from UK, I miss this in India.
Yes.
We should have this facility for our population as well.
Yes.
It just opens you a lot.
Yeah, being a
It's a
doctor, you can't explain everything to all the patients. So
Exactly.
in these healthcares in UK, Australia, they have different like check nurse and nurse navigator, occupational therapist, physiotherapist,
Right.
social worker. There are so many roles that you explore, and
Exactly.
that's great. And I have few more
Is it the
questions.
same in
Yeah.
yeah? Is it the same in Australia? Like you just mentioned,
Yes.
is the discharge process similar, or
Yes.
is the structure
Yes, it's
similar
not
there?
about sending the patient home as soon as possible. However, the beds are always full and everything, just to make sure that patient is safe at home. So if there's
Yes,
any issue with housing, maybe there are some toilet modifications that the patient needs after stroke. So they need to do that. There's funding from
yeah,
government and it's a very good process. That's why the life expectancy here is, I guess, around 90. There are all the patients are 95, 98, 100 years that get it.
exactly. I've seen 198 years old patients,
Yeah,
and that's
lots of patients.
the usual thing
Yes.
there.
And 70 years or 75 years old will come to your clinic or emergency with your with his father. Like, this is my father. He's
Exactly.
having the
Yeah,
cough.
yeah.
Yeah. So
Yeah, and
that's
like it's very new. One of the times was that in India, like we see, if it's a 60 years old patient, we consider them old, and if it's
yes.
80, it's way beyond. But
Yeah.
80 is the normal age, and
Yes.
90 is like, okay, he's old now,
Yeah.
and below that, everybody is young.
Hmm. So how would you say, like, if you are given a chance to go to UK right now as a consultant, not as a registrar or trainee, as a consultant, or stay in India as a consultant, what are your thoughts?
Well,
Just
I have
simple
mixed
answer.
thoughts, but I would say I'll stay in India. It's not because of the work thing and everything. It's just because I am more well versed with the system here. Consultants, they have a better life, they have better pay, but the expenses are through the roof. So as you progress ahead in life, that is also one thing. But then working as a consultant in the NHS is a different ball game altogether.
Yeah.
It is a different thing about prestige. It's like very prestigious, and then you're working with best facilities. So in that way, like I said, I'll have mixed thoughts. I might
Yeah.
want to move abroad as
Also,
well.
you should choose UK as a consultant because then you can move
Yeah.
to Australia as a consultant. So
Yes,
that's
definitely. So, in fact, Caesar pathway or the portfolio pathway is something everybody should at least consider once in their life,
yeah.
even if they've not gone to UK via MTI or PLAB or MRCP, because it
Yes.
always opens up a pathway for you, and you
Yeah.
always have experience.
And yes, so let's just wind it up. And
Yeah.
do you have anything to share that I missed asking or?
I think we've covered pretty much everything.
Yes.
And if
And
not,
yeah.
they always have us to contact.
Yeah, so what I'm gonna do is I'll leave it to the audience. If they have any questions regarding MTI, UK, PLAB, just comment below and Dr. Deepanjali is happy to answer. If you want personalized guidance, Dr. Deepanjali also provide one-to-one sessions. The link will be in the description. And even if
You
you
can also
can't,
DM us.
yeah, yeah.
You can
She,
also DM us on
yeah.
Instagram.
She's on Instagram. She's quite popular there. You text her there, DM. If you can't get a reach to her, just DM me. I'll send you there. Okay. So
Definitely.
that's all, guys. Comment below, ask your questions. We are happy to answer and follow for more. Dr. Deepanjali, you got YouTube channel as well?
Yeah, I have a YouTube channel just starting there and Instagram page.
That's cool. So support Dr. Deepanjali. I'll be mentioning all her handles. Go bother her. Ask her questions. Okay. Okay.
Happy to them.
Yeah.
Thank you so much.
It was lovely talking to you, Dr. Deepanjali. I hope this session got recorded because the last one was a very good session that couldn't
I
get
hope
recorded.
so.
So yeah.